In this video, we're going to show how to activate the muscles, the corrective muscles for the scoliosis in a vertical position. And but in the beginning, I like always to put a TheraBand in the on the leg of the concave side of the lumbar region. Okay, so I'm going to show how you can put the TheraBand. The TheraBand would be, I can in the beginning bring and just tighten the TheraBand here, and then I'm going to, as in the upper extremities, externally rotate the TheraBand twice, okay? And here, I'm just going again to tighten the TheraBand. So, what this will do is, the patient can stay with this TheraBand a little bit, so you saw that I'm externally rotating. Why I'm externally rotating? When we have a concave side of the lumbar spine here, at the concave side, always you have a rotation of the hip anteriorly, an internal rotation of the hip joint. So if I have internal rotation of the hip joint, it means that the iliopsoas adductor muscles are contracted. So when I'm putting the TheraBand in external rotation, I'm giving an impression to our mind, to the mind of the patient, that I want to externally rotate the hip. So I want to activate the external rotations of the hip, which are the gluteus medius, minimus, maximus, and the small like piriformis, gemellus, etc. Okay, so, and also the external rotation of the hip, it's more a supportive way. So the patient feels more support on their hip, and it's easier for them to stand on one leg. Okay. So she's going to come in front of a chair or a stool or a table, whatever. She's going to support herself with the right side, the concave side. So she's going to flex her left leg in front. Okay. So here, of course, we have again the same thing as in front of the Swedish wall stairs. Sorry. We have a correction in the frontal plane. I'm just going to ask her to a little bit activate the gluteus muscle here, support herself more with the right leg, and also squeeze her abdomen a little bit. So I will have a posterior tilt of the pelvis. Okay, this is the correction for the pelvis. In the beginning, you can stay here. Okay, just to explain to the patient what they will do. She can just stay here without any correction of the thoracic spine, and I'm just going to ask her to stay here and just breathe in, squeeze a little bit here, great, and breathe out. Try to breathe in on your belly, okay, and breathe out. Squeeze your shoulders down and try to breathe in on your belly, perfect, and relax. And after she's able to do this like 5-6 times, then I'm going to ask her to correct herself in the thoracic spine. So I'm going to bring the left hand up. I'm going to open the concave side. I'm going to bring the right hand in external rotation depression, retraction of the scapula. And I'm going to help her stabilize the pelvis. And I'm going to ask her to rotate herself towards me in this case, okay? So what she's doing, okay, squeeze a little bit more, perfect. So what she's doing, she's rotating posteriorly the concave side of the thoracic spine. She's supporting here, and this position, again, rotate your head forward. Stay in this position, and now breathe in and breathe out. Perfect. And breathe in. Perfect, and breathe out, and relax. And now we'll start from the beginning, so I will show you from the beginning how you do it. Patient is standing on the concave side, the right side. She's bringing her left leg up. She's squeezing her abdomen, pushing her right leg down. Squeeze, stay here. So she's rotating her hip. She's bringing her hand up. She's bringing the other hand in retraction, depression of the shoulder, push down, great. Now I'm just keeping her stabilized, rotate, 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 rotate. Okay, perfect. Stay here and breathe in. When you have a patient with scoliosis, when they are doing this, because our patient doesn't have scoliosis, but if you have a patient with scoliosis, when you are doing this, you would see the spine being elongated and corrected. Really, you can see the correction of the spine, okay? In some of the photos that you saw in the theoretical part, you saw the correction of the spine. So this is what you would see in our patient, okay? And relax. And she's going again to bring down the leg, and she's going to repeat this a lot of times, so she's going to understand how to correct herself without even me showing her. So it will be easier for her to understand that she's going to bring up, rotate, breathe in, relax. Bring up, rotate, breathe in, relax. So when you are repeating an exercise, the central nervous system, you give information to the central nervous system that this is the ideal exercise to do, and the muscles are going to automatically correct. And she's going to do these exercises day by day. You're going to give her some of this exercise at home, and she can come to you like once or twice a week, and you are reactivating the same muscles. Automatically you will see an elongation of the spine, and you see a correction of the spine. Okay, so try, but this is the last exercise that you have to do, because the vertical position, she's just standing on one leg in one way, so it's very difficult for her to do this exercise in the beginning, or for him, depending on the patient. So try to keep this exercise in the end, the most advanced sessions, and also start only with the pelvis, and after the pelvis is supported and stabilized, then you can continue with the thorax.